My name is Rowena Ventura, and I am an uninsured advocate for Neighborhood Family Practice. Neighborhood Family Practice is wonderful. It's a federally qualified health care center, which when I was a patient and my children were patients, I didn't know that. I just thought it was a group of doctors that decided it was more economically feasible to have a facility like this shared responsibility as far as cost. I had no idea even what a federally qualified health care center was. But they treated me so well, and when I lost my insurance, I was thinking, well, I'm going to the doctor and telling him I don't have insurance any longer, and they're not going to want to see me. And they said no. They reassured me that that's not how that they do their practice. And so I think that I really became aware of what a federally qualified health care center was at that point. Neighborhood Family Practice basically saved my life. I think that they help this community. They help a wide variety of people in the community. Whether you have insurance or not, you're treated the same. I mean, that makes a big difference to people when they have to go and see a doctor. They don't want to feel like because they don't have insurance that they're not going to get the same quality of care. And the quality of care has never changed, whether I had insurance or whether I didn't. I always say I'm not a victim. I prefer to say that I'm here to make change and to be empowered enough to come out to the community and talk to people and to understand the needs of the community and their needs. It just brings great change in a person's life. When I go into the community and I go into different events, I take the support forms for different organizations. One is for the Ohio Association of Community Health Centers, and I ask them to get involved, to read the form, and there's a variety of ways that they can become an advocate for themselves or someone in their family. And usually they're most interested in just getting the information, and I believe once they get the information, they start to get educated and start to move into more of an advocate part or a partnership with different organizations such as the Ohio Association of Community Health Centers. And people are more receptive when they feel like they're a part of something and they're joining something and they want to be, they don't want to be isolated. They want to be more involved. So once they start getting the emails and reading them and understanding the movement, what's going on as far as health care, then they can see that they can be a bigger part of the picture and they're not alone. And I think that's just, I think that's great. It's a great tool to get people talking about health care reform and as well as getting involved.